Hello, Carolina Bob out of Charlotte, North Carolina. Go Carolina Panthers and Carolina Tar Heels. I'm going to talk a little bit about today on my Cpap. Okay, I was diagnosed by Dr. Kirsch after a sleep study to have mild sleep apnea. Talked to a lot of my friends and they just smiled and they said, man, you know, that can be taken care of easily. Dr. Kirsch talked about the dental thing. Couldn't hear him push my jaw out like that. I don't know what exactly it's supposed to do, but he looked at my mouth. He said, I don't have any upper molars. I'm one of these poor folks. I'm poverty, and I have no insurance covering dental care, which I've never understand why an insurance company won't do it. They have riders that you can pay extra for, but the insurance company itself does not do it. Okay, let me talk a little bit about Dr. Kirsch. He tells me to give the Cpap a try. If that doesn't seem to work, what he wants to do is possible surgery. Now, possible, that's the last resort. Now, when I was told about the Cpap, I got very excited. I thought, now I'm going to be able to sleep, I'm going to feel better, be energetic. I was very positive. The first night I used it, had some problems, no big deal. Second night I had some problems, no big deal. You know, I was told, you know, it might take several weeks before you get used to it. Upon the third week, I was severely sleep deprived, and the Cpap kept me up all night long. I am a very light sleeper, I have always been a light sleeper. I mean, somebody in the room can just make a slight movement and I'll wake up. That's been a problem with noise and stuff. And of course, that will be a problem with me waking up. The doctor's aware of this. I told him, I've told most all doctors, that I'm a very light sleeper. I'm really believing that Dr. Kirsch and other neurologists are more leaning towards particular companies, Healthy at Home for me, towards the Cpap. Are they getting paid extra for it? I don't really know. I really don't. I don't know if Dr. Kirsch is being paid under the table. I have no proof that he is. But it is really interesting to walk in his office and see all these Cpap masks everywhere. I'm like, what's that all about? I really believe that most doctors should rule out other problems with sleep before a C mask is actually prescribed. I think a C mask should be prescribed for severely sleep apnea people. Those are the ones that stop breathing, have a hard time breathing, and wake up several times during the night. They need that continuous positive airway put in. Okay, so I gallantly tried the Cpap over a period of time, 40 days. My sleep problem got so bad that I was having memory lapses, actually falling asleep with my eyes open, falling asleep in inappropriate places, having problems on my job. And I mentioned that to Dr. Kirsch. Dr. Kirsch said, well, I'll tell you what, stay on the Cpap. We're going to adjust the pressure, because I was telling him how it was leaking out of the mask. He said, well, adjust the pressure. He did that. Still, it didn't work. It didn't work. So anywho, after about 40 days of this crap, I decided I'm not doing this anymore. I need to at least get a few hours sleep. And I'm getting none with the Cpap. And I mean none. I was up all night long. So I made a decision to quit using it. I called Healthy at Home, told them. I called Dr. Kirsch's office and told them. Now Coventry Healthcare is out to get me. The insurance company feels that if they spend their money, and I think it was around $790 for my ResMed Cpap, if they have to pay $790 and you don't use it, then you're going to pay for it. You know, insurance companies, you imagine how much money they make? I mean, think about it, okay? I'm paying a very low premium, but the government's paying them full premium. You better believe an insurance company is not going to lose no money. They're a business. That's what they are. It's a business. They're not going to lose any money. So here I am, faced with having to go against the insurance company, which I'm going to do. I'm going to get free legal aid, tell the attorney about it, tell him that Dr. Kirsch, I'm going to show him all the medical records. That Dr. Kirsch basically was saying, we'll try the Cpap if it doesn't work, and then possible surgery. And he might have said other options. But I mean, for a doctor, don't you think that he should have explored the other options first and then prescribed the Cpap? Instead, he prescribes the Cpap and check the options later. I think most sleep doctors, that's the first thing they do. Okay, first thing they do is to, boom, get on Cpap. And not everybody can use the Cpap. Unfortunately, not everybody can do that. So, Dr. Kirsch, Coventry Healthcare, and Healthy at Home. That's where I'm going right now. I'm not going to allow that insurance company to strong-arm me. And the reason why I'm making this video is to let other people know that if you don't have severe sleep apnea, you do not need a CPAP. Tell your doctor that. Say, hey, I watched a guy's video on YouTube, and he made the comment, unless I have severe sleep apnea, a CPAP is not necessary. And it's not. So don't allow your doctor to automatically say you need to use the CPAP. How bad is your sleep apnea? If it's not, there's other options. Plenty of options here on YouTube that you can look at. Now, I'll tell you quickly my own diagnosis. I've diagnosed myself. I believe part of my problem is, and let me do this for a minute here. Alright. Part of my problem is that I have an enlarged prostate. I sort of guessed it, but I wasn't 100% sure. Doctors do not check the prostate much anymore. That's old school. Most of you newer doctors, unless there is a reason to check your prostate. I found that interesting. I have gone, I'm going to say, upwards to 2 years or more without a prostate exam, a digital prostate exam. So the reason I know I have an enlarged prostate is stop and go peeing, frequent urination at night because my bladder isn't properly emptied. Okay, so do you think that maybe keep me up at night? Which I also had mentioned about me getting up a lot at night. Doctors used to rule out specific things that might cause the problem before they prescribe. I don't see why I wouldn't. I mean, if I have a patient, that's some of the things I'm going to do. You know, I'm going to say, have you had your prostate checked recently? Especially if it's a man that's going to be 60 years old. Have you had your prostate checked? That may be part of the reason of the nocturia. Have you had your self-check for diabetes? That could be a problem with your nocturia. If you have nocturia, you're not going to sleep. You're going to be up all night long peeing. So I'm going to have my prostate checked, guaranteed that I have an enlarged prostate, and cause me problems at night. Why couldn't Dr. Kirsch figure this one out? I mean, a medical doctor, well respected. I don't get it. Why couldn't he have said that? A doctor knows. If I tell you I have nocturia, he's going to rule out some things. Prostate, bladder problems, it could be diabetes, or sleep apnea. Okay. So the insurance company's coming after me. Coventry Healthcare, come get me. Have a nice day.